Hello, I'm Dr. Robert Saper, and I am the Director of Integrative Medicine at Boston Medical Center and Professor of Family Medicine at Boston University School of Medicine. I study the effectiveness of complementary therapies, such as yoga and acupuncture, and I have a special interest in investigating how they can be used to effectively relieve pain. I believe that we all can benefit by understanding how we can combine the best of Western medicine with other safe and effective approaches to improve our health and well-being. Today, I would like to share with you some alternatives to potentially habit-forming opioid medications, such as codeine, oxycodone, OxyContin, and Vicodin, that are often prescribed for reducing pain, especially after an injury, surgery, sprain, or strain. In 2017, nearly 50,000 people died in this country from opioid drug overdoses, and many more people live with an addiction or dependence on opioids. It is one of the most significant public health tragedies of our time. Nearly 2/3 of opioid overdoses during this period were related to people of all ages wanting to control their pain. Many of the young people who eventually became addicted started their dependency after being given opioids to relieve post-surgical pain, such as after having their wisdom teeth extracted or for treating a sports injury. While opioids may be appropriate in some instances, it is best to use them only when other safer alternatives are not adequate, and only after a discussion of the risks and benefits with the medical provider who prescribed them. I want you to be an educated healthcare consumer so that if or when you or your child is in pain, you can make the right choices with your medical provider. Let's review first what should be done if you are injured. If you have a sprain or strain, the first thing you should do is rest. And if you can, raise the area above the level of your heart. Also, to reduce uncomfortable swelling and inflammation, keep applying ice to the area for 15 to 20-minute periods at a time. Ice is very effective. It may also be helpful to compress the area with an ACE bandage to further reduce swelling. Here's a way to remember what to do right after an injury or sprain. RICE stands for rest, ice, compression, and elevate the affected area. Ice is best used for the first 3 days. Avoid putting your weight on the injured area if you are feeling severe pain. As you begin to heal, start using the affected area as much as you can tolerate. Over time, increase the amount of motion and weight bearing that you can tolerate. Taking an over-the-counter non-steroidal anti-inflammatory drug, or NSAID for short, can also help with pain and inflammation. Common NSAID medications are ibuprofen or naproxen. Brand names you may recognize include Advil, Motrin, Aleve, and naproxen. Taking other over-the-counter medications like acetaminophen, such as Tylenol, can also help control pain, but they do not reduce inflammation. A combination of both NSAIDs and acetaminophen can be used together for even greater pain control. NSAIDs can also be prescribed safely by your clinician at higher, more effective doses. Medicines applied to the skin over the affected area, such as diclofenac gel, capsaicin cream, and lidocaine patches, can also be tried for localized pain. You can speak with your pharmacist or medical provider about your options. If over-the-counter drugs are not working for you, there are also stronger prescription medications that are not opioids, which you can explore with your healthcare provider. Prescription medications, such as higher doses of an Advil or Aleve, as well as muscle relaxants, have been found to be as effective or more effective than opioids. But I do want to caution that both over-the-counter and prescription medications can have interactions with other medications you may be taking or may not be advisable if you are pregnant or have specific health conditions. So I advise discussing your current medicines or new health conditions with your healthcare provider. The timing of taking medications is also important to understand. Don't wait, for instance, until after the pain becomes severe to treat it. If you are likely to experience pain or swelling, take these medications at the early onset of pain. If you are prescribed medications according to a certain schedule, don't wait until the pain breaks through before taking them. The pain will be more effectively kept under control when you manage your medications this way. It may take a few days before the injury starts feeling better. If, after 3 days, the pain has not begun to decrease or is even getting worse, or if you believe that the injury may be more serious, such as a broken bone, you should have medical personnel evaluate the problem. Now let's talk about a common type of surgery, oral surgery. After you or your child has dental surgery, it is a good idea to follow the surgeon's advice, including resting up for a day or two. He or she will likely recommend putting ice packs on and off the face every 15 minutes. Also, propping your head up on pillows is a good idea. NSAIDs and/or acetaminophen are first-line medications for dental pain recommended by the American Dental Association and the Centers for Disease Control. These should be sufficient to control any discomfort from the surgery. Opioids are rarely needed. If opioids are prescribed, only a small number of tablets, such as 6 to 10, for a maximum of 1 to 2 days, should be taken. Back pain is a very common cause of discomfort. 80% of adults have at least one back pain episode in their lifetime, and 5 to 10% develop chronic back pain. Applying heat packs for back pain can help after a sprain or strain. If not, you can try cold packs. Taking over-the-counter anti-inflammatory medications, such as ibuprofen or Advil, can also help. The generic brands are less expensive. Try these strategies for the first day or two after the injury. Then try over time to gradually increase your activity as best as you can. It's good to try and start walking as soon as you're able. You should also know that acetaminophen, such as Tylenol, has not been found in studies to be effective for an acute low back pain episode. I would also consider proven approaches other than medications to control your pain or in addition to medication. Approaches such as physical therapy, chiropractic, and acupuncture are some examples that have been shown to be effective in relieving specific types of pain, such as low back pain and neck pain, as well as osteoarthritis and fibromyalgia. They can be used alone or in combination with each other. I'd like to review some of your options now. The most common non-pharmaceutical therapy to improve pain following an injury or different kinds of surgery is physical therapy. That is because there is a lot of evidence that it can be effective in improving pain, function, and range of motion. A physical therapist will suggest specific exercises and other hands-on treatments in an office, hospital, or home setting. The good news is that most health insurance policies will cover the cost. Chiropractic medicine, practiced by licensed professionals, primarily uses hands-on manipulation of the spine to reduce back and neck pain. There is evidence that they can be safe and effective in treating short-term as well as long-term pain. Chiropractic manipulation can also help restore mobility that is restricted by injuries. Many chiropractors also use exercise therapies as part of their treatment plans. Acupuncture is an ancient practice whereby very thin, sterile, disposable needles are placed in the skin at specific points on the body. Some very good studies have shown acupuncture to be effective in addressing lower back and neck pain as well as headaches. Other conditions where acupuncture may be effective include osteoarthritis pain of the knee, carpal tunnel of the wrists, and dental pain. Acupuncture can also be effective when combined with other pain-relieving measures, such as medication or massage therapy. Acupuncture is very safe when provided by a licensed practitioner. The needles cause little, if any, discomfort when inserted. Acupuncture is generally considered to be safe for children as well, and can be used to help control headaches, abdominal pain, and nausea and vomiting after surgery. Massage therapy is practiced around the world. A trained massage therapist uses their hands to rub the muscles and soft tissues to promote relaxation and healing. Massage can also promote stress reduction and provide other pain relief. Massage therapy studies have shown effectiveness for acute and chronic low back pain and knee arthritis. Some massage therapists specialize in treating specific kinds of pain and injuries. Yoga is widely practiced in the United States, and just about anyone can practice yoga. Yoga uses simple stretching, postures, and breath control to promote health, flexibility, and relaxation. Yoga can be effective in addressing various forms of pain. Yoga classes which are helpful for pain are often called gentle yoga, restorative yoga, or hatha yoga. Research has shown yoga to be helpful, in particular for chronic lower back pain. Since our minds play a role in producing the perception of pain and in promoting healing, certain kinds of mind-body therapies can train your brain to react or perceive your pain differently. They can actually change your brain chemistry to help you perceive less pain and better cope with the pain you do feel. These mind-body therapies can be especially effective for managing low back pain, muscle spasms, and headaches. Two therapies that have been shown to be effective for reducing pain include cognitive behavioral therapy, or CBT, and mindfulness-based stress reduction, or MBSR. You should seek out a licensed therapist, such as a social worker or psychologist, who is specifically trained in CBT to help you learn these practices. Mindfulness-based stress reduction, or MBSR, is an 8-week course taught by certified MBSR instructors. These courses can be found in person at many hospitals and health centers. They are also available online. Pain is experienced by nearly everyone at some point in their lives, especially back pain and headaches. While we hope your pain can be eliminated entirely, that may not always be possible. The goal of pain management is to minimize feelings of discomfort enough so that you can function and lead as normal a lifestyle as possible. Sometimes, potentially habit-forming medication or surgery is necessary to address pain. However, too often we rely on them when pain can be properly managed by safer methods. You may be surprised at how effective they can be. Unfortunately, some of these safer alternatives are not covered by your health insurance, and they can become expensive over time. Your best chance of getting insurance coverage for safe, effective, non-pharmaceutical therapies is when your physician prescribes them. Also, check into your company's flexible spending plan if they have one. This can be an option for reimbursement if your physician recommends the treatment. Contact your insurer and employer to find out what they cover so that you can weigh your options. If your medical provider prescribes opioids, let them first know that you are open to trying safer, effective alternative treatments first. If you both decide that opioid pain relievers are still your best option, take them on a short-term basis, no more than 3 to 5 days, to reduce the chances of dependency. You should also know that opioids tend to lose their effectiveness over time. Make sure you use them as directed and dispose of them when you are done at a drug take-back kiosk or at your pharmacy. Thank you for watching today. I wish you good health, and if you are in pain, a speedy recovery. We should work together to advocate for better insurance coverage, for proven, safer pain options for everyone, so that our opioid overdose epidemic finally becomes a thing of the past. Here's how to learn more.